Each day, more than 300 Americans are shot, and according to the CDC, more than 110 are killed by gunfire. The Government Accountability Office reports that gun violence costs hospitals over $1 billion annually. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hedderly with AHA Communications. Dr. Chetan Sathya, a pediatric trauma surgeon and director of Northwell Health's Center for Gun Violence Research, recently testified in front of the United States Senate Judiciary Committee on this topic. He sits down today with Laura Castellanos, Associate Director of the American Hospital Association's Hospitals Against Violence Initiative, to discuss what we know about the cost to hospitals and health systems as they treat a growing number of victims of gun violence.
Welcome, and thank you for listening. I'm Laura Castellanos, Associate Director for the AHA's Hospitals Against Violence Initiative. Back in 2019, the AHA launched the public health approach to addressing gun violence. This initiative provides tools and resources for hospitals, health systems, and healthcare providers as they play a significant role in responding and reducing the risk of gun violence. Today, I'm delighted to welcome a very special guest and a friend. Hello, Dr. Sathya. I really appreciate you joining us today for this AHA Advancing Health in America podcast. Today's topic, the cost of gun violence to hospitals and health systems. Couldn't think of anyone better. Thank you for joining.
Thank you, Laura, for having me today.
Absolutely. So let's start off with talking about Northwell Health's work. Northwell has been exploring the public health approaches to gun violence. Can you tell our listeners what you have learned is the role of hospitals and health systems in breaking this cycle of gun violence?
Absolutely, Laura. And first and foremost, thank you to yourself and the American Hospital Association for really leading when it comes to how hospitals and health systems can tackle this public health epidemic. This is a question that we commonly get. And the first thing I like to say is that this is not only a public health issue, this is a healthcare. This is the leading cause of death among American children right now, and one of the leading causes of death among adult Americans as well. So, this has been one of our chief public health crises for the last decade. It is something that many of us in the healthcare space see day in and day out and are seeing in a more increasing fashion. We've all read the recent stats and we've seen that uptick in gun violence. Hospitals and health systems have an absolutely essential role to play because most folks who are injured by firearms do at some point come to a hospital. And that is our opportunity to really prevent another firearm injury from happening, or in the case of some of the screening that we're doing in Northwell, for example, really preventing that gunshot from even happening in the first place. So first of all, I think clinicians, healthcare providers have a huge role in what they can do at an individual level, and hospitals and health systems as an industry can really be a bully pulpit in advancing the reframing of this public health issue to be a public health issue, not a political one.
Absolutely. I'm going to continue on a little bit more on the work that Northwell is doing. And specifically, you have a learning collaborative looking at the health system's interventions specifically, right? I wanted to get from you, what are some of the learnings? I know that you are, I believe, into phase one, but if you can quickly tell the field what we're doing as a collaborative to really understand some of those evidence-based and leading practices.
Absolutely. So the Learning Collaborative is really a grassroots national kind of forum for folks across the country to present some of the work that they've been doing so that we can all learn together. When it comes to the gun violence prevention space, it's only really a small subset of hospitals across the country that are doing meaningful work in this area. And there are, a majority of other hospitals that really want to get engaged. They just don't know where to start. So that's really the purpose of the collaborative, is to share those learnings. We are finishing, as you mentioned, phase one, which was very focused on education. So, we went through some of the main topics when it comes to hospital-based violence intervention programs. What's the evidence behind that? What's the evidence behind safe storage counseling and other evidence-informed interventions that we can do as clinicians? We talked a little bit about policy as well. and what the research landscape looks like. This is a disease that needs to be researched. There are many, many knowledge gaps, and I think it's an opportunity for a lot of young investigators to get involved. So we kind of covered the whole gamut of educational modules on gun violence prevention, and I can certainly share that link as well. What I would say that we've learned is that they're very broadly, because we could talk about this for hours, and I'm sure we'll get more granular on some of these interventions, but very broadly, as I mentioned, when you look at the tenets of a public health approach, which include data surveillance, right? So knowing who shot, when, and how, the identification of risk factors and protective factors, the development of preventative strategies, and then the implementation of those strategies, there are a number of different things that we know might work, but we have major data gaps when it comes to all those tenets of a. So I really like to emphasize that we need to figure out what a public health approach to gun violence is. We don't know all the answers because so little research has been done in this area. And so I think that's come across loud and clear in the first phase of the collaborative. So the next phase is really focused on figuring out those answers and continuing to implement what we do know might work to further evaluate.
Thank you. Thank you for sharing. Going on to thinking about what are some of the starting off points for folks leading this work, both at a national level all the way down to the intervention. We would like to know, how do we quantify the cost of gun violence to hospitals and health systems? Really understanding that costs go beyond that initial either emergency room visit or hospitalization, really looking at the long-term needs of those victims. So what can you share with us about what you understand are those costs to hospitals and health systems?
Yeah, they are huge, huge. And I'll talk through some of the numbers, but it's important to remember, again, that because of our lack of great data, these numbers are probably all kind of undercounting the true cost of gun violence. However, we know, for example, there was a recent Everytown report that showed that the overall economic toll of gun violence, whether you're talking about the initial medical costs, the secondary trauma, the societal costs as well, amount to something like $500 billion per year for the American taxpayer system. So that is a significant cost in itself. Now, we do know that initial medical costs alone for gun violence in this country amount to about $1.1 billion per year. And it's really important to point out that the majority of that cost is actually funded by public payers, so Medicaid, Medicare, other public payers, and then 20% is covered by private insurance. So this is something that private insurance is having to front the cost for as well, but mainly taxpayer money for public healthcare coverage. And another thing that has really come across as you look at the numbers of the economic toll of gun violence is how expensive it is to treat firearm injured patients. If you look at the average cost of a in-hospital admission or an emergency department stay for a firearm injured patient, it is 3 times that of any other in-hospital or emergency department stay. And this is not surprising, right? Firearm injuries are complex. They cause a lot of disability. If they don't kill you, they can injure a lot of organs, leading to a lengthy recovery, operating room costs, and so on. So this makes a lot of sense for us. If you compare kids who are injured by gun violence versus kids who are injured by cars, motor vehicle collisions, it is 5 times more expensive to treat a kid with a firearm injury than it is a motor vehicle collision. So this is absolutely an issue of firearm injuries and how expensive they are. It's a huge tax on the healthcare system. That's one thing. And second of all, just remember, we all know what it's like when a firearm injured patient comes into the hospital. The entire hospital goes into a standstill. The trauma bay is activated. The operating room is put on hold. This has all kinds of downstream implications for patient care and other elective surgery. So that's a huge thing. And then not to speak about the hidden cost of gun violence, which is really that secondary trauma, right? If you think about PTSD, substance use, behavioral issues that result from gun violence itself as a secondary type of trauma, the societal impact, we're all nervous as parents now sending our kids to schools. This all has major, major economic repercussions.
Thank you. Thank you for sharing. I know you've definitely are leading the conversation when it comes to helping the field quantify this cost. Moving on a little bit more, not only as to what Northwell is doing, but I know other health systems are as well are looking at that research landscape. Could you help us understand what types of research and what progress we've made as a field to look at the public health approaches to gun violence?
Yeah, for sure, Laura. And I'll focus more broadly in that Up until 2019, because of the Dickey Amendment, there were no federal funds for gun violence prevention research. After 2019, that has since changed. We still get only about 25 million in federal funds every year through the CDC or the NIH for gun violence research. So this is still a drop in the bucket compared to any other leading cause of death. But this is a huge, huge step forward. Remember, prior to 2019, gun violence research had received less than 0.7% of the funding that other leading causes of death with similar mortality rates, like sepsis, ever received. So, this is a very unresearched field. We certainly need more money, but these new federal funds have really served to legitimize firearm injury prevention, gun violence prevention research as a core field of study. We need to build on that momentum. We need to generate new researchers who are focused on this. I think that is how the field has changed the most. If you look at the number of conferences that are focused on firearm injury nowadays, it's far greater than anything 2 years ago. The number of applications, grant applications, the number of publications is ramping up. That is what's going to make the difference. Because to your point, we have major, major data needs when it comes to data surveillance, data infrastructure, identification of risk factors, interventions, evaluations. We really, really need this research. Now, we have come further in understanding that there are strategies that we know work, right? Safe storage counseling, when it comes from a physician or clinician, really works. It can save a life. It can prevent a firearm-related suicide or an unintentional injury in the home. We know hospital-based violence intervention and trauma-informed care can really serve to help prevent gun violence from happening again, particularly in at-risk communities. We're getting more and more data that things like red flag laws or extreme risk protection orders can work. That's obviously something exciting to talk about, as there's funding in the new bipartisan legislation to support red flag laws. So we're starting to generate that data. We just need to have that momentum continue.
And, let's talk about that momentum that is building. And actually, it was something covered at the last Learning Collaborative session, the Bipartisan Safer Communities Act. And I know you had Senator Murphy as a guest in the session. I wanted to just for our listeners, could you please provide the healthcare leaders, executive, clinician leaders that are doing this work, kind of the quick overview, the takeaways from this very significant legislation, which I'm sure we'll hear about more.
Absolutely. And I think for healthcare leadership, in particular, healthcare executives, this is really exciting. I already talked about the research funding opportunities ramping up, but this bill is another sign that billions of dollars are being poured into gun violence prevention, hospital-based violence intervention. And this is an opportunity for every hospital to engage, to figure out, how those funds can be used adequately to support community programs, but also support the right type of research that'll get us the answers we need. So this is a huge opportunity, I think, for healthcare leadership across the country when you think about program building, right? We've never had this much money being allocated to this type of work. So first and foremost, that's important to say. The bipartisan legislation is really, history in the making. It's the first bipartisan gun legislation in 30 years. It is a small step in the right direction. We all hoped for more, but certainly, I don't think we've ever had this many Republican senators vote in support of gun legislation like this. And, it provides millions in funding towards the implementation of red flag laws, which I talked about a little bit earlier. We are seeing more states also making doctors, like here in New York, petitioners for those red flag laws. So healthcare is getting increasingly engaged in that. That is going to be critical for those of you who don't know much about these red flag laws. They offer families an opportunity to temporarily restrict weapons from loved ones who might be at risk of self to others. So these could certainly prevent a suicide, an unintentional injury, or even a mass shooting. Because family members can be worried about certain individuals and they can temporarily restrict these weapons. Again, nothing we advocate for is related to the Second Amendment whatsoever. This is about firearm safety and safer communities and responsible gun ownership. So there's a lot of funding towards that. There's millions of dollars towards crisis management programs and violence intervention, which again, as I mentioned earlier, hospitals have a big part to play in. We know that evidence is really working to help prevent violence in at-risk communities, which is a critical player here when we talk about gun violence. We're seeing millions also put into mental health services. Important to remember that folks with mental health issues are more likely to be victims of gun violence than perpetrators. But these are dueling public health crises. We have a mental health epidemic in this country as well. So those funds will be much needed. And of course, there is an intersection at some level between mental health and gun violence. And, these things don't happen in silos. So we need to address all these different things, truly make a difference. So those are the big parts, I would say. ERPO laws, funding, as I mentioned, for violence intervention, funding for mental health services. And then fourth, would be expanded background checks for folks who are between the age of 18 to 21 to have more scrutiny on who can and cannot buy a weapon in that age group.
Thank you so much. I know that this is, like you said, history in the making and lots of activity at every level that we're seeing both nationally at the state and but definitely from the field. I wanted to just give you a moment to see if you have any final thoughts that you'd like to share as we close this podcast.
Yeah, no, I think, we as a healthcare industry, and when I say healthcare industry, for far too long, it's been frontline providers, researchers, social workers, nurses, doctors, pushing forward the fact that this is a public health crisis, with very few in healthcare leadership really taking a bold stand on this. And I think, the AHA has an incredible job in trying to galvanize folks around this public health crisis. This is an issue that affects us all. When we talk about gun violence, we are talking about firearm-related homicide, suicide, and unintentional injury. This is something that can happen in every community, all of our communities. And so I think the more we have that discussion, the better. Our CEO has obviously been very outspoken on this, Michael Dowling. That has been a tremendous impact to us on the front lines because it has empowered us to really, really move forward in tackling this issue in our own communities. So the more we come together on this, that the healthcare industry has a tremendous opportunity to make impact, create change, lobby for common sense policies. And I think it's time we can't sit on the sidelines anymore.
Thank you so much for sharing. It is an absolute honor to have you join us. And we definitely will share some of the resources that you mentioned for folks to learn about what Northwell Health is doing and able to join definitely in the work that you're doing as well. With that, I want to thank you all for joining the podcast, Advancing Health in America, looking at the cost of gun violence for hospitals and health systems. Thank you.